So we're going to do a quick knee joint examination today, starting with inspection. So facing straight on with the patient and his feet relatively close together and his legs as straight as possible. We're looking for symmetry. So we're looking that there's no rotation or varus or valgus deformities. We're looking at the bulk and symmetry of the quads and the calves, and that's all very symmetrical. We're also looking for any obvious effusions, anything like that. So that's all normal. We'll get you to turn to your side now and line up the heels and legs as straight as they can be. So there's no hyperextension, everything's looking symmetrical, but he does look like he's got flat feet. And then turn to the back. And lining up the popliteal creases, they look symmetrical. There is some pronation of both feet, a bit more pronounced on the right, and the feet do look flat, but we'll get you to raise up on your tippy toes, and the arches are formed, so that's corrected with movement. And then turn to the other side. Line the heels up, again, no hyperextension, looking very symmetrical. Okay, can you face me again, and can you squat down towards the floor, please? Great, and just another time. Good, and can you go a little bit further down? Very good, okay, so that's pretty normal. There was no guarding or movement to one side or twisting, and he's got good range of motion. We'll get you to hop on one leg now. Great, and the other leg. Good, and none of that is painful and he's very stable. Can you jog on the spot briefly? Again, looking for symmetry, and the movement is very symmetrical, that's great. And we'll get you to just hold on to stabilise yourself. Lift one knee off the ground and bend the other, and then twist to the right and left. Okay, that's good, and there's no pain, and he's very stable. So that's a good test for meniscal injuries. We'll get you to walk towards me now, and turn around and walk away. So he's got pretty normal stride length, toe heel stride, symmetrical, no antalgic gait. That's great. We'll get you off on the examination couch. So have a lie down, and making sure, maybe you can just go a little bit further up in bed, making sure now that the hips are square and straight, so checking the ASIS are even, and they are, because that can help us determine leg length discrepancy. So he's got just very slightly longer leg, maybe half a centimetre on the right, and that's pretty common. We're going to also check for hyperextension there. You know, there's maybe a couple of degrees, but it really isn't significant in terms of the legs. Now, just general inspection, so we're looking at the quads, symmetry, bulk, and the calves. We're looking for major effusions or scars or deformities, and there's really nothing to see on inspection. Now we're going to do some active movement. So I'll get you to bend this knee up as far as it can. Yep, okay, good. So he's getting, and then I'm just going to take a little bit further. Good. So I can get 5 fingers in between his calf and his thigh, so that's pretty normal. Good. And then I'm going to check your hip range of motion at the same time. Internal, external rotation, and that's normal as well. Now we could compare to the other leg, but in the interest of time, we're just going to focus on one leg today. So now palpation. So there's a couple of landmarks to be aware of. So starting with the patella, and we can do this at a slight flexion. So palpating the border of the patella medially, feeling for bogginess, tenderness, deformity, and then the patellar tendon and the tibial tuberosity. So that all feels normal, although the tibial tuberosity does seem a little thickened. Now we're feeling the joint margin. So in the soft sulcuses here, we're going to be pressing along medially, and you'll feel the firmness of the medial collateral ligament, and then you go past that all the way around to the back to feel the tendons at the back. Okay? And so when you're feeling that, you're feeling the top of the tibial plateau and the bottom of the femoral epicondyle, and if there's any irregularities along there, particularly meniscal tears, that would be tender. And then on the left, same again, so that's off sulcus, and following that across the lateral collateral ligament round to the back and the tendon, and then you can feel the femoral head as well, and there's no tenderness and no deformities there. Okay, you can feel around the back of the knee for any lumps or pain, and that feels normal as well. And then we'll get you to just straighten that knee out, and we're going to check for an effusion. If you had a large effusion, we could sometimes see it with the naked eye, or we could compress the suprapatellar pouch to raise the patella and then tap it down. That's the patella tap. But in this case, there's no effusion, so we won't see that. For small effusions, you're better off to milk the fluid out of the medial compartment and then compress the suprapatellar pouch and then sweep the lateral compartment and look at this medial sulcus for fluid that's shifting across, and there's none there, but that can reveal smaller knee effusions. The other thing for movement is just checking for crepitus in the knee, so bending the knee up, feeling for crepitus, and there's none there. Also having a look at tracking the alignment of the patella with the movement, and that's very straight. Okay, good. So, so we've checked along the joint line for meniscal pain. Now we can check the collateral ligament. So you can do this in flexion. So as you feel across that medial border, you feel the thickening of the medial collateral ligament, and you can follow it up to the medial femoral epicondyle, and you can follow it down. And same with on the left, for the lateral collateral, you can feel the thickening, you can follow it up, and you can follow it down, and then you can palpate the femoral head as well. Now, we could also test not just for tenderness, but for stretch of these ligaments. So we can do that in extension. And we're wanting to create a bigger angle than what's normally possible. And the main thing is to not rotate the leg too much when you do that. Okay, so he hasn't got a lot of give, a couple of degrees, but that's normal. We can test that though in flexion. Trying to increase the angle, and there's a couple of degrees, but that's within the normal range. Also, so that's testing the collateral ligaments. Also, when we're testing the meniscus, we might find that there's a painful clunk when we're extending the knee and palpating over the joint line. So, let's find it again. Okay, so bending it up and then rotating and extending, good, and then the other way and extending. Okay, and there's no painful clunks over the joint line. We should check the cruciate ligaments. So you can look for posterior cruciate ligament damage from the side, looking for a sag, and there's no sag here, so the tibia hasn't dropped behind where it should be. And you can look for anterior cruciate ligament injury by stretching that ligament, and it should reach a firm endpoint. And if it doesn't reach a firm endpoint, then that suggests it's compromised. So one way of doing that is to pop the knee under their thigh and to just try and make sure they've relaxed the back of the knee, the muscles there, and then with a firm hand lifting it up, and you'll reach a firm endpoint. And again, you don't want to have them in too much rotation. Okay, so he's got a nice firm endpoint there. So the cruciates are intact. Lastly, looking at the patella again. So we know the patella is quite a mobile structure, but it shouldn't be moving more than about a third across the midline. So popping your finger on the midline and pressing it to its extreme medial lateral range, and that's not moving by more than a third. Also, you can palpate for patellar tendonitis by pressing on the proximal pole of the patella, which lifts up the distal pole, and that can help you get your finger right up in there where the patellar tendon is. And if that's really sore, that would suggest patellar tendinopathy, but that seems fine as well. So just to recap, we've looked for symmetry, we've assessed the range of motion, we've palpated for tenderness along the medial joint line for the meniscus and the medial and lateral collateral ligaments. We've also then tested the stretch of these ligaments and the cruciates as well, and everything's in the normal range. So there's a few other specific tests, but if you keep to those main ones, then you're testing the main structures of your knee and you'll pick up the most common pathologies.